Former and current patients are now being recruited and trained to assist province-wide teams improve the delivery of healthcare in Alberta. Once trained, these individuals become patient engagement researchers and become formal members of the teams called Strategic Clinical Networks, or SCNs. SCNs are comprised of healthcare professionals, researchers, community leaders, and policymakers. Together, their goal is to find ways to enhance the patient journey, improve outcomes, and standardize care delivery across the province. The patient engagement researchers, using their own experiences, will gather information from other patients and families through surveys, interviews, and focus groups. This information will be used to help improve the patient experience.
I was just so thrilled. First of all, I could do something which I quite enjoy doing, which is talk to people. Although one of the things I did do was make sure this was a proper study, that it wasn't a cup of tea study, you know, like they have the ones where you sit down and have a cup of tea. This was a valid and reliable study. It was one that would have standing, because that's important to me.
My job is to help get the strategic clinical networks up and running, and we have 6 of them that have been launched in Alberta Health Services: cancer, seniors, addictions and mental health, obesity, diabetes and nutrition, bone and joint, and cardiovascular health and stroke. And the role of the patient engagement researchers on each of these strategic clinical networks, I think, is a really important way for the voice of patients to work with professionals, clinicians, and administrators in the health system to be planning best evidence care.
Coming in, we expected maybe 5 to 10 people. We've got 30 who've signed up. So this is the beginning of a movement in Canada that will set us apart from the rest of the service providers internationally. And it is important. It is important that we take the time to learn about it, to let it evolve, to let the professionals, the researchers and the clinicians, and the patients find new ways to work together if we're going to indeed make sure that our healthcare is sustainable. And the more we balance, the more we allow all perspectives to come to the table, to plan and to make sure that things are being done the best they can, the better off things will be.
The ability to reach out, having something to reach out to other people who have some disease, is very different than a professional researcher or a student researcher, which I am, but a peer student researcher is what I am, doing it. And the opportunities have been endless. And I am so grateful and so thankful that I have found this particular thing to do.
We've worked really hard to make sure that we have frontline clinicians involved in planning. And we have taken it one step further to make sure that patients and their families and those voices are also part of that planning and the strategic initiatives moving forward. We think that's the way to build sustainable health care, and we're really excited about the potential that not only this role, but the SCNs in general have in making Alberta's healthcare system the best in Canada.
Patient engagement researchers go through a 1-year training program funded by the Canadian Health Services Research Foundation. They receive a stipend for their research work. Patient engagement researcher training resumes in September in both Calgary and Edmonton. If you are interested or know someone who may be, please contact Dr. Svetlana Sklarov or visit our website to find out more.